is ill. I also understand that Senator Nielsen won't be attending at all. Is that correct? Okay. So we will start as a subcommittee. Assuming we get a quorum, hopefully very soon, whoever will be presenting will interrupt at that time. Before we get started, I'd like just to say Happy New Year, everyone, and welcome to the Senate Health Committee. We'll go ahead and get started. I believe I saw Senator Liu, item number 1, SB 280, Insurance Accountability Program application form. Good afternoon, Senator, and welcome.
Thank you, Mr. Chair. I'd like to thank the Chair and Committee for their time on this important issue. We know that health disparities exist in California. For example, numerous studies reveal that members of the LGBT population continue to suffer worse health outcomes than members of the non-LGBT population and often receive low rates of health insurance coverage. Due to a continual lack of data collection concerning sexual orientation and gender identity, we're only able to estimate the full extent of the health disparities facing the LGBT community. Current existing law requires California to create a streamlined application for its insurance programs in accordance with the Affordable Care Act, including Medi-Cal and plans sold through the health exchange. The current form includes voluntary questions of demographic data categories such as race, ethnicity, primary language, and disability status. However, the form does not include comprehensive demographic questions, including questions about sexual orientation or gender identity. This bill would require the state's application forms for affordable health insurance to add voluntary questions to the demographic portion of the form regarding sexual orientation and gender identity, and codify that the state's application continues to ask questions on disability, race, ethnicity, and language. With that, I witness this here in support and respect request and I vote.
Thank you very much. Please proceed. State your name and your position.
Thank you, Mr. Chair and members. Joe Michael for Equality California, proud sponsor of SB 280, which, as amended, requires the inclusion of voluntary questions about sexual orientation and gender identity on the application form used for various health insurance programs. Comprehensive demographic data is key to effective operation of state health insurance programs. This data helps us to understand and address health disparities related to personal identity factors that affect healthcare outcomes. We know from various studies, including those by the U.S. Department of Health and Human Services and the Institute of Medicine, that health disparities impacting lesbian, gay, bisexual, and transgender people are real. These disparities include high risk for cancer, mental illness, and other diseases, as well as higher rates of smoking, alcoholism, and drug abuse. SB 280 will help to address these problems by allowing individuals to voluntarily provide information about sexual orientation and gender identity, just as individuals can currently indicate information for race, gender, and disability. We cannot work to address the health disparities in our communities until we begin collecting this data. We thank Senator Liu for his leadership on this issue and respectfully urge your aye vote. Thank you.
Thank you, Mr. Chairman and members. Alice Kessler. I'm here representing the Transgender Law Center, and for the reasons stated, we also strongly support the bill. We have been working administratively to get this data collected. Those conversations continue, but there currently really is a dearth of information for the LGBT community, and the data is desperately needed. The California Health Information Survey does collect some data on sexual orientation. We even asked judicial applicants voluntary questions about sexual orientation and gender identity. For these important programs, we also feel very strongly that the data should be collected, so would urge your support of the bill.
Good afternoon, Chair, members. Tahira Cunningham with the California Pan-Ethnic Health Network. CPAN is a multicultural health advocacy organization dedicated to improving the health of California's communities of color. We align our comments with our colleagues and would just like to say, to address the prevalent health disparities that are experienced in California's diverse communities, our state healthcare programs really must improve the way we collect and analyze this data so that we can really try to address those disparities. So again, we urge your support.
Mr. Chair and members, Elizabeth Landsberg with the Western Center on Law and Poverty, also here in support, concurring with my colleagues. As Ms. Kessler said, we have been trying administratively. Western Center has done a lot of work on the joint healthcare application. We have asked Covered California and DHCS to add these optional fields, and they have not done so. So we do feel it's important for the legislature to act. Thank you.
Thank you, Mr. Chair and members. Kathy Sunderling with the County Welfare Directors Association, also in support of the legislation. We think it makes sense to add these optional fields to the application.
Thank you. Anyone else in support? Maybe, I think there's one right here, or if somebody could please state your name and your position.
Yeah, Mike Montgomery with the Congress of California Seniors. We support the bill. Please
Thank you. Any opposition to the measure? Any comments or questions from any of the members? Seeing no comments or questions, as soon as we establish a quorum, Senator Liu, we will, hope somebody will make a motion and then hopefully get it off to the next
Thank
committee.
you.
All right, thank you. Looks like I thought I saw Assemblymember Gomez, is that correct? Okay. Oh, there he is. Okay, we're on item number 5, AB 485, Gomez In-Home Support Services.
Thank
Good
you,
afternoon.
Senator. Good afternoon.
Assemblymember, welcome.
I'm wearing glasses to see if I earn extra brownie points with you.
Those are good-looking glasses, sir.
Thank you, thank you. Mr. Chair and members, let me accept an author's amendment that changes the effective date to 1/1/15 in the bill. Now to the bill in chief. Currently, wages and benefits for IHSS providers are bargained at the county level with local public authorities. Existing law states that the California In-Home Supportive Services Authority will assume the employer responsibility for collective bargaining in a coordinated care initiative county once any component of the CCI occurs in a county. Unfortunately, delays and changes to the timeline of the CCI have led to delays to this transition. Therefore, AB 485 would require the statewide authority to assume the employer responsibility for collective bargaining in all 58 counties in California, beginning in January of 2015. This bill would effectively delink the transition to state-level collective bargaining from every other aspect of the coordinated care initiative. I have several witnesses here to testify who are well versed in the issue and can answer any questions you may have.
Thank you, Assemblymember Gomez. My name is Christina Voss Hamilton. I'm with UDW AFSCME. We are a co-sponsor on this bill. We consider this bill to be really just a cleanup item in that it would effectuate the original intent of SB 1036, which created the IHSS statewide authority. Unfortunately, because the Coordinated Care Initiative has had so many delays due to the complex nature of the initiative, we have had these delays in our move to the statewide bargaining, and we would like to see ourselves disconnected from the CCI so that we can proceed with our efforts to set up this IHSS statewide authority. Thank you, and we request your support.
Mr. Chair, members, Robert Harris on behalf of SEIU California. Everyone's covered pretty much everything already. That we do remain committed, even with the delinking, to making sure that the CCI rolls out and is effective and fulfills the promise that it has about better care for Californians. Thank you.
Mr. Chairman, as the members asked me, we concur with the previous comments. Thank you. Ask for your aye vote.
Mr. Chair, member Sarah Flox, California Labor Federation, and we are also in support of the bill. Thank you.
Anyone else in support? Any opposition to the measure? Comments or questions from any of the members? Seeing no comments or questions, still no quorum at this time. As soon as one is established, Assemblymember, we will put it up for a vote. Thank you. Would you like to close?
No, I just asked for your aye vote.
Thank you very much. Thank you. I believe I see Senator Yee. We're going to move on to item number 3, SB 596, Multi-Tiered Interventions Pilot Program. Good afternoon, Senator. Welcome.
Hi there, Doctor. Mr. Chair and members, this is a project of mine that has been long overdue to come to fruition. Now, after I don't know how many years I've been here in the legislature, we've been trying to find a way to establish a mental health program for all kids within our school system. Time and time again, we've had major issues with students not succeeding, not because of the fact that the instructional program is not as best as it could be, but more because the inattention to some of the social issues mental health issues that confront so many of our young kids. Finally, we have, I think, a program that really reaches across the board for all kinds of kids, but more importantly, that it integrates a special ed program and the regular ed program. Out of this particular proposal is also a funding mechanism, and hopefully there will be a lot of information as to how do we make the program sustainable through whatever funding source we're talking about. And so what this bill will do is to really establish this kind of a program through a pilot program, 4 of them, 2 in the north, 2 in the south, and hopefully with that we will be on our way to really addressing all of our kids' needs. I just again want to thank your staff for helping to move this particular idea and help it come to fruition, and with that, urge an aye vote.
Please proceed. State your name and your position.
Mr. Chair, members of the committee, my name is Ken Barrett, and I'm the founder and CEO of the Seneca family of agencies and a member of the Alameda County Board of Education. And I want to thank Senator Yee for authoring this bill for us. This bill is the next iteration of what have been a series of progressive movements across education and mental health. And I know the committee is aware of the idea of community schools and integration of health and mental health services into schools. The problem that we're trying to address here is while those services are co-located, particularly as it relates to school climate, school culture, mental health, and special education, they are rarely, if ever, fully integrated. And that results in statewide somewhere around 60% of special education funding ends up going to high-end segregated sites that are combined mental health and education sites, or special day classrooms with mental health components that aren't fully integrated to the classroom. We'd like to see that dynamic change, and we'd like to see the funding that's been associated with that over time moved back into the classroom to support the whole school and combined with a tiered intervention approach that fully integrates mental health, special education, and school climate, school culture, which sets the groundwork for a much more effective intervention setting. By doing that, we anticipate, and the reason you see 3 years of declining funding, that there would be enough savings after 3 years on the non-public school and segregated site portions of special education and mental health intervention to fund much deeper interventions school-wide and change the texture and climate in schools across the state.
Please proceed. State your name and position.
Thank you. Rusty Seelix, California Council of Community Mental Health Agencies. We've known for a long time in mental health that people don't get their mental illnesses treated for an average of 6 years after their onset. We set aside money in Prop 63 for counties to do programs to do that. This is something the counties can't do by themselves. This is something that requires the school districts to see the value of this because the savings come in special education. This pilot program is designed to demonstrate that this will pay for itself in terms of reduced special ed costs and get schools to want to do this. The payoff in terms of mental health and education will be enormous, possibly save $100 for every dollar that's spent. We believe it will be sustainable so that this modest amount of upfront money is probably all the state will ever have to spend to really create an enormous paradigm shift in schools and in mental health.
Mr. Chairman, Randall Hager on behalf of the California Psychiatric Association. I'd like to echo the comments of my colleagues who've testified previously. It is really important to note that about half of those people who will develop mental disorders do so before they turn 18, and so it makes perfect sense to be focusing on schools. The earlier we can intervene in the etiology of a course of illness or mental health, better, obviously, the outcomes, and I agree with Rusty that the cost savings will prove effective and probably will repay the outlay in the initial years.
Sean South, California Primary Care Association, in support.
Thank you very much. Anyone else in support? Anyone in opposition? Or support or opposition? Support. Before we continue with the support, were you going to be taking the amendments that we're going to be clarifying, I believe, in the next committee hearing?
That's correct. No, in this committee.
Except here?
Right. No, I don't think you're going to let me get away with that easily, Mr. Chair.
I just didn't hear it in your opening comments.
Hi.
Support?
Yes.
State your
Danielle
name.
Millay, California Alliance of Child and Family Services, in support for all the reasons already stated.
Khalif Basagai with the National Alliance on Mental Illness, California. We don't have an official position on the bill, but we do expect to support the bill. We're really focused on providing children with mental health services in the classroom. We really feel that an integrated approach is best to ensuring that kids reach their full academic potential. Cost savings will come from in the ways, the reasons that were stated by Mr. Seelix, but also in that keeping kids in the classroom to get these services will improve graduation rates and ultimately reduce cost of college dropout or high school dropout. So,
thank you.
My name is Latanya, and I'm a parent of a child that receives counseling and therapeutic services, and I support the bill.
Thank you very much, and thank you for being here.
My name is Leo Fuchs. I'm the principal of an elementary school in Oakland, California. That's the population we serve. 97% of our students receive free and reduced price lunch. We believe that an integrated services model like this will dramatically impact our ability to serve the whole child and help students reach their potential.
Thank you. Anyone?
I have a question.
I think we have a quorum. Can we let us establish a quorum before we move on? Secretary, call the roll, please.
Hernandez.
Here.
Anderson. Bell. De Leon. Desagne.
Here.
Monning.
Here.
Nielsen. Pavley. Wolk.
Here.
A quorum has been established. I believe there's a question from Senator Wolk.
Yes, Senator Yee, I think this is an excellent proposal. And I realize that I think the issue of cost will come into play here. I have a question. Whether Prop 63 funds could be used for these kinds of programs?
Probably Rusty Seelig can answer that.
I don't know that much about it.
Counties have Prop 63 funds. They could use those funds to create these programs. But right now, you can't do this program without a partnership between the schools and the counties. Most of the costs are outside of Prop 63. They're school costs. And so the concept here is to incentivize schools and counties to develop those partnerships by demonstrating that the cost savings are there. And then we think after this pilot program, we would expect counties to put up some Prop 63 money to match other school money to make these things happen.
Okay, thanks.
Any other questions? Senator Bell?
Just to thank Senator Yee for his outstanding work, and everybody should know that 35 years ago I met Senator Yee when he was a psychologist working with families getting off the boat from Vietnam and having trauma and the experiences of trauma and helping the kids and the families recover. And we had long lines out on the street, even outside the office, in line waiting for care, Senator. And he's well renowned in our county for his work in mental health, and I know he knows a great deal about the needs of children, and I respect him for it, and would like to be added as a co-author of this bill at the time you make your amendments. And I support this bill, Mr. Chairman.
Mr. Chair, if I can just comment. 35 years ago, I had to plead before a supervisor for money for my agency, and that happened to be Jim Bell. And I think, and because
Not
of that,
long ago. Come on,
and,
I'm not that old.
and because of that, he has the distinction of being called Mr. Mental Health in the county, and there are a lot of individuals who are very, very thankful for that, and I think that's one of the reasons why he chairs the Mental Health Caucus for the Senate.
Thank you.
Move on.
We have a motion to move the bill by Senator Bell. I'd like to just make a comment. I'm supportive of the issue. I think it has merit. I can understand why you want to do a pilot program, obviously, because of the cost. If there's a way you can figure out how we can integrate this service with the Prop 63 money to supplement it as well to make it successful. And then the other question, or I guess concern I have, is getting the appropriate providers to be able to see these individuals in school That's also a second part of it, without putting undue burden on the teachers themselves, but looking at getting mental health providers in the school systems so that we can prevent any kind of mental illness. But I'm very supportive of that. Would you like to close?
Sure. Again, let me thank your staff for all of your the help on this particular matter, so that we are very, very clear, Mr. Chair, that we are taking as author's amendment the requirement that to apply for this particular program, that we're talking about schools with student bodies that consists of 60% free and reduced lunch to be eligible to participate in the pilot program. So we are taking that.
Thank you.
very much.
And with that, we have a due pass as amended to appropriation. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Anderson. Bell. Bell, aye. De Leon. DeSaulnier. DeSaulnier, aye. Munning. Munning, aye. Nielsen. Pavley. Wolk. Wolk, aye.
That currently has 5. We do have some absent members. We're going to put that bill on call, and but it looks like it has enough votes to get out. Let's go ahead and start back at the item number 1, SB 280. Is there a motion? We have a motion by Senator Bell. This is SB 280. This is due pass to appropriations. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Anderson. Bell. Bell, aye. De Leon. DeSaulnier. DeSaulnier, aye. Munning. Munning, aye. Nielsen. Pavley. Wolk. Wolk, aye.
That currently has 5. That's enough to get out, but we do have some absent members. We'll put that bill on call, and we'll lift the call when the other members arrive. Let's move to item number 5, AB 485. Gomez, is there a motion? Moved by Senator Bell. This is due pass as amended to appropriations. Call the members.
Hernandez.
Aye.
Hernandez, aye. Anderson. Bell. Bell, aye. De Leon. DeSaulnier. DeSaulnier, aye. Munning. Munning, aye. Nielsen. Pavley. Wolk. Wolk, aye.
That currently has 5. Again, it's enough to get out. We'll put the bill on call. We have some absent members. We're going to now move on to item number 4, SB 747. DeSaulnier.
Thank you, Mr. Chairman, and I really appreciate the opportunity to at least have a conversation starter about the issues that I've tried to bring up in SB 747, and I really want to also thank you and your staff for working with me during the past year. It's, as I've explained to you, it's an issue, and Senator Monning, I want to thank on the Budget Subcommittee that I once chaired, and he currently chairs. We had a really good informational hearing that dealt broadly with this subject. I do want to say that you'll be happy to know that the bill in its former iteration was a job killer. It is no longer a job killer. That was supposed to elicit a laugh from the opposition. And really the reason I want to have this conversation is about shifting costs from the private sector to the public sector. For those of us who like to read things like Joseph Stiglitz, he's talked a lot about this, that the issue of rent taking is more, and particularly in the field of consumer products and public health. So I was my other career was in the private sector. I owned restaurants for 35 years. I was responsible for 4 liquor licenses. I made money selling liquor and food products. I've done this long enough to remember when Mothers Against Drunk Driving started, and most of my contemporaries and colleagues in the restaurant business had a problem with that. We came to learn, and I came to learn early, that it was my belief I didn't want to be in a business or career that caused the kind of public health consequences and the personal consequences that when the oversight we had to selling liquor had very little liability to the purveyors. That changed, and it's been for the better, and it's lowered our costs and saved lives. When secondhand smoke came along, a lot of people in the restaurant business thought that that would be the end of our business as a point-of-sale retailer. Turned out it's saved a lot of cost, and it improved the public health system. So in your analysis, you'll see both the Schwarzenegger administration and the current administration has done research, or has done research, and others, where 70% of all deaths in the United States are from preventable conditions, and more than 75% of the total health care costs comes from preventable diseases. So the purpose of the conversation is how do we, and this is difficult, and this is where your staff's been terrific, and a lot of the question about being too broad is on page 3. But how do we have a discussion and analysis about what products responsibly in a competitive free market should be able to make a profit, a reasonable rate of return, but not shift their costs to the general public, and in this instance to the public health system. So what this bill has done, its previous iteration was, I can't think of a better analogy, but it was sort of like sequel without a private right of action, where people would, consumer products, if we could define them properly, that had a very significant cost and contribution to epidemics, would have to at least give us a response to the public health officer how they would mitigate those costs. The threshold we came up with was $50 million to the state's public health system, including hospitals and clinics and Medi-Cal. So what this bill does is far removed from that. There was never a private right of action in this. We tried to avoid any kind of legal issues, and that's still a continuing conversation with our opponents and with your staff, and we'll continue to, if the bill moves, have that conversation. But then it was, so the process now is purely, it allows the public health officer under circumstances, certain circumstances, to send a letter as defined to somebody who has a contributing product to the threshold of $50 million to a public health epidemic as defined on page 3 in section 1 under section A under contributing products. So the public health epidemic to which the product contributes is one recognized by the Federal Centers of Disease Control and Prevention, the United States Department of Health and Human Services, the Surgeon General, or the United States Food and Drug Administration. I will admit, and the opponents will say, that these are not exact sciences and there are different places to go, but it's a place to start. So if the public health officer has that evidence and can establish that there's credible evidence that a consumer product, contributing product, has this kind of impact, then the public health officer may send a letter to the identified manufacturer. It would have to be a large manufacturer. We've tried to avoid hurting smaller business by saying they have to be part of the group that's contributing 80% of the cost. And then at their free discretion, they can respond with an analysis of what that cost is. They would be required to, the manufacturer would be required to contribute up to $20,000 for the public health officer to accept that analysis. So the step is the public health officer, under fairly specific guidelines, but they're a work in progress, and this bill is a work in progress because this is a complicated area both of law and consumer product rights. The public health officer may, under this statute, send a letter to the identified manufacturer of the contributing product, and they may ignore the letter or they may respond. It's up to them. So that's it, basically. I'm, again, very appreciative of the opportunity to talk about where the public sector in a free market has the ability to be competitive with other products that are at the same framework and the same rules, and then some analysis of how the costs are transferred. And I think, I hope it'll be a discussion that we can continue and have more robust analysis of. And if I'm fortunate enough to move the committee, it's my hope to work with the opposition to see if there's some way we can frame it that would be more acceptable to them. So once again, I appreciate the opportunity, and I will turn it over to my witnesses. I'm happy to have the public health officers here in support today.
Thank you. State your name and position, please.
Bruce Palmer with the Health Officers Association of California, representing the local health officers in California's 58 county and city jurisdictions. I think the new frontier of public health is emerging in front of us. We've already had great success in this last century dealing with infectious diseases, vaccines, creating safe water, sanitation. It's expanded the lifespan of the population considerably over time. The new frontier, though, relates to the conditions, environmental conditions impacting health. And that's where we're beginning to become more and more active, and it's transforming public health in this new century. Where health officers, local health officers across the state are already involved in planning decisions by communities related to development, doing health hazard assessments, and this is where public health in medicine is going in the future. If you want to bend the cost curve improve the productivity of your society, and make it more healthy, where 80% of the diseases are, you move upstream. You move upstream to the conditions impacting health, and you begin to change those conditions. And that is the way that we're going to create a healthful society and a manageable healthcare system in terms of how costs are incurred. So we're very excited about this. This is a very innovative, cutting-edge tool, just like the health hazard assessments and becoming involved in the planning process maybe 5, 6, 7, 8 years ago were a cutting-edge thing. Now they're becoming more regular, and they're having a tremendous impact on the quality of life in communities around the state, including our policies related to health and all policies, which we've been here before with Senator Desaulniers. We want to thank them for doing, once again, another cutting-edge thing that we think 5, 10 years down the road is really going to make a difference in the quality of life and the cost of health care. Thank you.
Sean South on behalf of California Primary Care Association. We represent nearly 1,000 clinics throughout the state and provide care to 5.5 million patients each year. We're supportive of this conversation because we can't control the root causes that our patients come with. We can't control what they eat. We can't control the neighborhoods that they live in. We can only provide them the care and the support that we have when they enter our doors. And we've been active on issues like menu labeling, trying to educate consumers so they better understand what's impacting their health. But I agree both with the author and the previous speaker that we need to get to the root causes of why we're so unhealthy. And we can provide drugs, we can provide therapy, we can provide surgery, but at the end of the day, if we're going to bend the cross curve, if we're going to have a healthier society, we need to start talking about the real issues that impact health. And I think this is a real good start to start having that conversation and start moving the needle on something that needs to be dealt with sooner rather than later. Thank you.
Anyone else in support? Is there any opposition to the measure?